Hi, you're welcome to Pal's Anatomy. This is where we make anatomy very simple. It's Professor Anyanwu Anatomy Lecture Series, and my name is Professor Anyanwu Emeka. Now to a very important part of the triangle, and this is the content of the femoral triangle. We have a number of structures that we noted pass through this region, and these structures are the femoral artery, as you can see here. We also see the femoral vein, as you can also see here. We have the femoral canal, a space that is medial to the femoral vein. We also have femoral nerve and branches, that's the femoral nerve here. We also have another structure, the lateral cutaneous nerve of the thigh. That nerve is supposed to run from here towards the lateral part of the inguinal ligament. And then we have the femoral branch of the genitofemoral nerve. That structure will be seen lying between the femoral nerve and the femoral artery. And then we have a layer of fatty tissue that actually scattered within this region that actually has these structures embedded in them. We will start with the femoral artery. The femoral artery is actually the distal extension of the external iliac artery. In our illustration, here is the external iliac artery still within the region of the pelvic cavity or the iliac fossa. Now, as soon as the external iliac artery runs distal to the inguinal ligament, it enters the femoral triangle of the thigh, and it will change its name to the femoral artery. Now, it passes deep to the inguinal ligament at the midpoint of inguinal ligament. That is at the midpoint between the anterior superior iliac spine and then the pubic tubercle. This artery at this point will be seen lying medial to the femoral nerve but lateral to the femoral vein. It runs distally and then medially. Now, by the time we see this oblique course of the femoral artery, we will notice that at the base, it is lateral to the vein, but at the apex of the triangle, because of its medial course, it will be seen lying anterior to the femoral vein. So, at the base of the femoral triangle, the axillary artery is lateral to the vein, while at the apex, the axillary artery will be seen lying anterior to the vein. Now, the femoral artery will give off some branches, 3 superficial branches and 2 deep branches. We'll consider these branches. We'll start with the superficial branches. Now, for the superficial branches, let's take a closer view. Here we'll be seeing the superficial epigastric artery, the first superficial branch. Next, we'll be seeing the superficial circumflex iliac, and that is the branch here. And then finally, we'll be seeing the superficial external pudendal artery, that is the artery here. Now, for the deep branches, we have 2. We have the profunda femoris artery, and that is the major branch of the femoral artery. That is the big branch here. It is the biggest branch of the femoral artery. And we also have the deep external pudendal artery, which is the artery here. We have some very important clinical correlates to the femoral artery. We'll start with palpation of femoral artery. Now, the palpation of the femoral artery, called the femoral pulse, can be taken at the area that is below the inguinal ligament. And here in our illustration, this is a clinician trying to feel the 2 ends of the inguinal ligament, the anterior superior iliac spine and the pubic tubercle, knowing that at its midpoint we'll be seeing the femoral artery. Now, the femoral artery will pass between these 2 midpoints and then will run distally. Now, in taking palpation of the femoral artery, the best point to do this is about 2 to 3 cm below the midpoint of the inguinal ligament. Here in this illustration, we are seeing the anterosuperior iliac spine, and this is part of the region we have the pubic tubercle. Now, this is the stretch of the inguinal ligament, and then we have about 2 to 3 cm below this. That's the best point to pick the femoral pulse, as you can see in the next illustration here. Now, why is this place the best point to pick the femoral pulse? It is because it is at this point that the artery will be lying immediately anterior to the head of the femur, and by this it will be easy to compress the artery at this point. Now, here is the femoral artery, and then if we take it up, we see that it will be easy to compress the artery around this region of the head of the femur to get the pulse of the femoral artery. At this point, it is very easy. Now, are there other clinical correlates regarding the femoral artery I would want us to know? Yes. Now, first is the easy accessibility of femoral artery. Now, because the femoral artery is actually very superficial in its location, it makes it an artery of choice for a number of clinical procedures, and one of them is the coronary angiography. Also, because of its superficial location, the artery comes very important in being able to stop heavy bleeding within the legs, where pressure can quickly be put at the region of the femoral triangle to help in reducing heavy bleeding or stopping it at the distal points of the lower limb. This artery is also very important in carrying femoral venipuncture procedure. We'll next look at the vein. The femoral vein is the proximal continuation of the popliteal vein, while the femoral artery extends from the inguinal ligament to the adductor hiatus, where it will continue as the popliteal artery. The femoral vein will continue from the popliteal vein, and at the point of the adductor hiatus, it will become the femoral vein, and then will run proximally until it gets to the external inguinal ligament. Now, the femoral vein has two major parts. Its lower half will be seen in the adductor canal, and this is the region of the adductor canal, while its upper half will be seen in the region of the femoral triangle, which is this region. So we are seeing the lower region, which we see within the region of the adductor canal, the lower part of the femoral vein, and then we're seeing the upper part of the femoral vein that will be seen within the region of the femoral triangle. Now, this vein will accompany the femoral artery. Here is the femoral vein, and then here is the artery that it is accompanying. Also, still on the femoral vein, we'll look at how it lies. Now, the femoral vein, as we noted in our discussion on the artery, lies medial to the artery at the base of the triangle, but towards the apex, it will be seen lying posterior to the artery. Now, it receives a great vein called the great saphenous vein. Now, this is the femoral vein, and then this is one of the veins here called the great saphenous vein that will be emptying into the femoral vein after passing through the saphenous opening of the fascia lata. It also receives other veins like the profunda femoris vein, and then the rest of the veins that be corresponding to the superficial branches of the femoral artery. In the clinical correlates of the femoral vein, we will first look at the femoral vein cannulation. Just as we noted in the femoral artery on its easy accessibility, the same also applies to the vein. Now we see the vein being the most common approach for vascular access used for diagnostic cerebral venography and also neuroendovascular venous interventions. Now, the anatomical landmark for femoral vein cannulation is about 2 to 3 cm below the inguinal ligament and then 2 cm lateral to the pubic tubercle. The next important structure we'll consider is the femoral nerve. Here is the femoral nerve. Now, this nerve is the largest branch from the lumbar plexus. Now, this nerve is the major nerve of the anterior compartment of the thigh. Considering its origin, here is the lumbar plexus, and then this is the femoral nerve with roots L2, 3, and 4. This nerve has two parts. We see the part of the nerve within the pelvis, that's this blue colored part, and also we see the part of the nerve within the thigh, this green colored part. Now, the femoral nerve in the pelvis will be seen emerging from the lateral border of the psoas major. Here is the pelvic cavity, and then here is the psoas major, and we'll be seeing the femoral nerve emerging from the lateral border of the psoas major, and this is the femoral nerve. Now, as it runs between the psoas major and then the iliacus muscle here, we will see it sending some motor branches to the iliacus. These are part of the motor branches supplying this muscle, and then it will run distally deep to the inguinal ligament here, that's the inguinal ligament, and then it will emerge into the thigh. And then as it emerges into the thigh, it will divide into several branches. And then the part of the thigh we see it emerging into will be the femoral triangle of the thigh. The femoral nerve is not part of the structures that are seen in the femoral sheath. Now, here we'll be looking at the femoral nerve within the femoral triangle. Femoral nerve will be seen lying on the iliacus, that's the iliacus, that's the femoral nerve. And then we'll also see it giving a branch to pectineus muscle. It is actually the nerve of the anterior compartment of the thigh. Earlier on, we noted that the femoral nerve divided into its 9 branches. This was done very close to a branch of the femoral artery that is called the lateral femoral circumflex artery. That's the lateral femoral circumflex artery here. Now, this artery will divide these branches of the femoral nerve into 2 parts. We have the part we call the anterior, and we have the part we call the posterior divisions. Sometimes we see them called the superficial and the deep groups. We have 4 types of branches that be coming from those branches of the femoral nerve. We have those branches that be supplying the muscles, which we call the muscular branches. We have those ones that be going to the skin, which we call cutaneous branches. We have the branches that be going to the joints, we call those ones articular branches, and then we have the ones we call the vascular branches. From the anterior division, we'll be having 2 cutaneous branches, and then from the posterior division, we'll be having just 1 cutaneous branch. Summarily, these are the branches from the femoral nerve. Here is the lateral circumflex femoral artery dividing femoral nerve into those 2 divisions. We're having the anterior here and we're having the posterior here. Now, from these 9 branches of femoral nerve, we're having 2 muscular branches from the anterior division, and these are branches that are going to 1, the pectineus, and 2, the sartorius. Also, coming from the anterior division, we'll get 2 cutaneous branches, and these are the branches that are called 1, the medial femoral cutaneous nerve, and 2, we have the intermediate femoral cutaneous nerve. Now for the posterior division, here is the posterior division. We'll be having just one cutaneous nerve, and that nerve is a nerve we call the saphenous nerve. Now the rest will be nerves, branches to the muscles. And then the major muscle here is the quadriceps femoris. And now these are the various branches that be going to the quadriceps femoris. The branches that be going to the rectus femoris, lateralis, vasta intermedius, and then the medialis. And then from there we also have the branches we call the articular branches that will be going to the joint, like the knee joint. The next content of the femoral triangle is the nerve we call the lateral cutaneous nerve of the thigh, and the root values are L2, L3. Now here is the lateral cutaneous nerve of the thigh, and then medial to it is the femoral nerve. Now this branch we call the lateral cutaneous nerve of the thigh is actually a direct branch from the lumbar plexus. Now, just like the femoral nerve, it will enter the thigh, passing deep to the inguinal ligament. Now, also like the femoral nerve, it is seen outside the femoral sheath. This nerve will supply the skin on the anterior and lateral side of the thigh, which is this region. Also, like the femoral nerve, it will divide into two divisions. One is the anterior division and the other one is the posterior division. These are the two divisions of the lateral cutaneous nerve of the thigh. Now we have a very important procedure that is done on the lateral femoral cutaneous nerve, which is the lateral femoral cutaneous nerve block, where this nerve is anesthetized. Now this procedure is used in evaluation and management of meralgia paresthetica, and this condition is where there is a tingling, numbness, and burning pain in the lateral thigh, and this is usually as a result of compression or entrapment of this nerve. This procedure can also be used as a diagnostic tool to differentiate between peripheral nerve entrapment from lumbar radiculopathy. Now, this is also used in providing surgical anesthesia when there is harvesting of skin graft from the lateral part of the thigh, and also in relieving pains that can come maybe as a result of tourniquet. Another structure that we find in the femoral triangle is the deep inguinal lymph node. Now, we usually see three of these nodes that are seen at different points. One at the junction between the great saphenous vein and the femoral vein. Two within the femoral canal called the gland of Cloquet, and three at the level of the femoral ring. Because we want to make this lecture very brief, I'm going to stop this part of the lecture here, and then I'm going to continue the remaining part of the content in the next video I'm also making. And then in that video, we'll be looking at the remaining structures in the femoral triangle. Basically, we'll be looking at the femoral canal, and then we'll consider the sheath that actually wrapped around some of the structures we've mentioned. But by way of summary, we want to say that we've seen the femoral triangle. We said it is that intermuscular depression at the upper third of the thigh. Don't forget the structures that are found inside. Lateral femoral cutaneous nerve found on the far lateral part. Then we noted the femoral nerve. We looked at the structures, the branches from femoral nerve, and then we mentioned the femoral artery and then the femoral vein. So we're going to take a look at some very significant clinical correlates as we study the structure of the femoral sheath in the next video, the femoral canal, and the femoral ring. In that lecture, I'm going to be giving you the difference between the femoral hernia and then the inguinal hernia. Please make sure you also check that video. So if this video has been very helpful, we would like you to give us a thumbs up, press the like button, and then share the content of this video. Thank you. See you in my next class. God bless you.